In this episode of Breaking News with Bay, I wanted to talk to you about BMI, Body Mass Index. And this is when you determine how much fat somebody has based on their height and their weight. And the numbers are, anything from like 20 to 25, you're in a normal range. Over 25, you could be considered overweight. Over 30, you could be considered like obese. And so some doctors will say if you're over 30, they won't operate on you at all. But the problem with BMI is even though it does take into account height and weight, it doesn't take into account distribution of your weight. So for example, in this particular patient, you can see that she has a pretty reasonable torso where she has some excess skin, some excess fat, but most of her weight is in her thighs. So while her BMI may be more than 30, she's still a really great candidate for a tummy tuck, as you can see in these after photos. Because her torso is a reasonable size, we're able to remove the excess skin, do a lot of liposuction, and give her a nice result because most of her fat, most of her weight was really in her thighs, which is not an area we were taking care of. So just keep that in mind. And so what we do, and the idea with BMI is if you really have a really high BMI, doctors are concerned about operating on you because they worry that that might lead to more complications afterwards, or maybe you're unhealthy, maybe you have high blood pressure or diabetes. Those are other issues altogether. So if you do have those other comorbid conditions, as we call them, high blood pressure, diabetes, then we would want to address those things before we offer you cosmetic surgery. But in an effort to keep you safe, one of the things that we do is we make sure that we don't take off more than 5 liters of fat in each operation. So that might mean that we need to stage the operation. So rather than just looking at a number like BMI, we look at how much fat we take off during each operation, because it's shown that if you take over 5 liters of fat off, that can lead to a severe form of dehydration called hypovolemic shock. Obviously, we don't want to do that. We don't want to take any unnecessary risks for an unnecessary procedure like cosmetic surgery. So next time you're talking to your doctor and they're saying they won't operate on you because you have a BMI over 30, understand where they're coming from, but also realize that other doctors may take a different approach and still be able to offer you a safe and responsible procedure.